Welcome back to the Britt Mayer Show, where we talk about culture, politics, faith, and health, and we dive deep into the battles that are shaping our choices. And I am your host, Britt Mayer. Today, we are tackling a topic that is as vital as the air we breathe: the state of medical freedom in California. The Golden State's medical freedom landscape has been under siege for over a decade, tightening mandates, lobby-driven policies, and now a federal reckoning with RFK Jr.'s MAHA agenda. But what is California really doing, and what does that look like for parents? In a state that is often at the forefront of bold and sometimes controversial health policies, where do we stand when it comes to informed consent, transparency, and the right to say no to what enters our bodies? From vaccine mandates to chemical bans and everything in between, California's terrain is a battleground for personal sovereignty. So, what does this mean for parents navigating school exclusions and informed consent? We are going to break it all down today. And joining me for this eye-opening, California-specific conversation is Christina Hildebrand. She is the trailblazing founder and president of A Voice for Choice, California's leading advocacy group fighting for health rights since 2015. As a parent-turned advocate, mom, entrepreneur, and relentless researcher, Christina launched AVFCA in direct response to SB 277. If you're in California, you know that bill. This bill stripped away personal belief exemptions for school vaccines. She's been a key voice in California vaccine legislation, from testifying on SB 277 to exposing industry influences shaping the resistance for thousands. What started as a grassroots cry against overreach has grown into a powerhouse, a 501c4 organization lobbying at the Capitol, sponsoring landmark legislation, and waging two active lawsuits to challenge SB 277's iron grip, one for religious exemptions and another for antibody titer testing as a vaccine alternative. If anyone has the pulse on California's medical freedom frontlines, it is Christina. Today, we're going to unpack the wins, the ongoing fights, and what 2026 might hold for your family's health choices in California. How are new bills stacking up against privacy and transparency? What is next for litigation? And how can everyday Californians join the chorus for choice? Stick around, because this conversation is so eye-opening and will really set the stage for what's to come in 2026 in California. Please like, subscribe, and share the Britt Mayer Show wherever you are listening. This episode specifically is one to share with all of your mom friends and dads out there in California, because this is the stuff that Californians need to know. So with no further ado, here's my conversation with Christina Hildebrand of A Voice for Choice. Like so many of you mamas out there, I am increasingly busier and busier, juggling all the things. It's sports, it's extracurriculars, it's homeschool, my husband, the household. It's a lot. And one of the things that is incredibly important to me is health, not just for me, but for my family. And if mama goes down, the entire ship sinks. So as you know, I love We Heart Nutrition. I have used them solidly for over 2 years now and can't stop raving, because I love the people behind the company and I love everything about the products. First off, I love that every single bottle that I purchase, 10% goes straight back to pregnancy centers, which help moms choose life. And as a pro-life Christian, that is incredibly impactful. And I'm so thankful that this company stands behind that mission. I'm an investigative researcher, so obviously something that is really important to me is what is behind the packaging, the formulas. And We Heart Nutrition's are clean as can be, third-party tested, no GMOs, gluten-free, no junky fillers. They're gentle on the stomach, and they do what you want them to do. And here is the cherry on the top with We Heart Nutrition. They offer a 60-day guarantee that lets you try it without worry. And I think that you'll love it. So go to weheartnutrition.com and use code ROOTEDWINGS for an exclusive discount. Miss Christina Hildebrand, thank you so much for joining us for this dedicated California episode today.
Thank you for having me.
This is going to be, I wanted to say a fun conversation, but I stopped myself.
It's going to be fun because it's the two of us, but other than that, it's not, the content isn't that fun.
Content is not that fun, but it's really important. So you've been on the front lines through just about every major bill for a long time here in California, especially when it comes to medical freedom, which is what we are talking about. So I am thrilled to have you. And I know that I gave a brief intro, but I'd love for you to give just an overview of A Voice for Choice's mission and what you're doing out here in California.
Yep. So we educate, advocate, and empower people to know their health rights in California. And that really, I'll say we were MAHA before Make America Healthy Again was MAHA. We've been doing this for 10 years. Our goals are or our mission is in 3 different areas. It's to get toxics out of California, to ensure that there's informed choice and transparency of what goes into your body, and that there are medical privacy rights in place in California. So those are the 3 main areas that we cover. We do that through education. We have a weekly article that we put out, and then through lobbying in Sacramento, and then also through legal efforts.
Yes, and this is why I'm so excited to have you here, because you are behind enemy lines and you are in the belly of the beast. You're not just kind of from a distance looking at what's going on, but you are in there. You're embedded, you're advocating, you're lobbying, which is so exciting to have you because you are one of the most premier experts out here in California. So, what was it that sparked you getting involved like this?
It was SB 277. So in 2015, California passed a law that removed all non-medical exemptions, removed the personal belief exemption for vaccine mandates in schools. And at the beginning, I showed up as everybody else showed up. There were thousands of us. And about just before halfway through, I was just like, we need to work out how to work in this building, because it's not, us showing up isn't enough. And so I put together a Voice for Choice Advocacy, and we hired a lobbyist. And I, at the time, had my kids not on Monday, Tuesday, Wednesday. So I went up to Sacramento every Monday, Tuesday, Wednesday and shadowed her and really was in the belly of the beast, trying to work out, how to manage it and how to get around, work with the lawmakers. Unfortunately, obviously, that bill passed, and it was too little, too late. But we have grown that, and are really seen as a professional organization within Sacramento. When we go into legislative offices, they know our organization, and they know that we're to be trusted with science, and to be trusted, that we've done the research behind the recommendations we're making.
Yes. And I want to get into the whole lobbying side, because I think that can throw people off when they hear lobbying. We associate that with the negative, right? Because it's always the
Yes.
negative lobbies out in Sacramento or
Yes.
in Congress. But before that, I wanted you to walk us through the evolution of medical freedom in California over the last decade, because I think that's important to set the scene for those listening to really understand how much has progressed over the last decade in California.
Yes, and I think so I would say it's a de-evolution, if that's a
Yes, I would
word,
agree.
rather than an
Oh, I
evolution.
agree.
So I think we've gone downhill rather than
Yeah.
uphill in the last 10. It actually spans more than 10 years. So in 2013, then Assemblymember Penn, and Assemblymember/Senator Penn is sort of the bane of our existence on the medical freedom, on losing medical freedom in California. He put forward a bill that removed, or it required you to go to your doctor to have a conversation about vaccines in order for you to have a personal belief exemption. Before that, you just signed a waiver, and you were done with it. And at that time, I sat there and was just like, oh, I know, I've had this conversation with our pediatrician, no problem, we'll just sign it. We'll get it signed, not a problem. Didn't think that, that was the first step of many.
Mhm.
2015 was SB 277 that removed the non-medical exemptions. Then in 2019, we had SB 276 and 714, which really tightened the medical exemptions and basically removed medical exemptions as well from California, in effect. And that from there, it was sort of downhill. It kept going downhill. We got to COVID. There were a number of different bills that were brought forward with regards to the COVID vaccine. Thankfully, none of them passed. And by this time, I would say we were more savvy, more people were waking up. And I think while California law has not changed, we have definitely stopped some things. So we stopped those COVID bills. We stopped a bill that would have allowed 12-year-olds to get all vaccines without parental consent.
Mhm.
We stopped the HPV vaccine being added to the school requirements. And so while we haven't, as you said, evolution, we haven't evolved positively, but we're kind of hanging tight right now. And so I think that is a positive thing, because we haven't had anything bad keep going our way. Although, having said that, we do currently have the West Coast Health Alliance, which
Mhm.
Governor Newsom has, and I'm sure we'll get into it more, but
Yes.
Governor Newsom has basically said that California and many of the other Western states, and also the Northeastern states, basically all the blue states, are no longer adhering to the CDC guidelines.
So much there. It's happened so quickly. And I think
Yeah.
what I want to hone in on, just from what you said, is, in 2013, without that wonderful Senator Pan, which I don't even know what he's doing anymore, but I remember him well.
Oh, he's going to run for Congress
Oh, well, good to know. So,
against Kevin Kiley in a seat that was redistricted. So it's not good news.
oh, wow. Okay. So
Yeah.
Pan is going to run against Kylie.
Yes. Yeah. So we
That
need to
is
help Kevin Kiley.
huge news. And
Yes.
Kylie's up against a lot now because his whole district was just made into an elephant
Right.
with the new
Exactly.
gerrymandering. Oh my goodness. Okay.
Yes.
Well, we will be covering that. I'll have to have Kylie
Yes.
on to talk about that
Yes.
because
Yep.
Pan is the bane of my existence. I actually awoke to everything in 2013 as well. And so that was
Mhm.
really I would say 2012 was when I started to wake up, but 2013 was a huge wake up year for me as well. So Pan was on my radar through all of
Yeah.
this out here in California. But what you said about how, you just went in to have your conversation with your pediatrician and just assumed, oh, it's just no big deal. That's how they get you. It's all these no
Yeah.
big deals. It's like, oh,
Mhm.
because I was in the same boat. I remember signing I believe it was the personal belief exemption first. And I kind of felt the same. I was like, well, there's this exemption. Well, they took away this exemption. There's this exemption. And then, they ramp up all the way to where you can't even, and I want you to talk about this. It is so hard to get any form of exemption in California if you
No,
have,
you can't.
you can't. But
Yeah.
it was death by a thousand simple cuts where you just thought, oh, it's no big deal because I have this. No big deal. And then they just pull the rug out. Before you know it, you don't have anything anymore.
Yeah.
Yeah.
Yep. You're boiling the frog.
Yes. Okay. You've highlighted how industry influence, this is going to get into the lobbies, like California Medical Association played roles in pushing these bills, which would be the lobbying groups. So how did those groups change everything out here in California? And what dynamics have you exposed within California when it comes to medical freedom for our kids?
Yeah. So, let's take 2015. We had one lobbyist, and I'll go back to your comment of lobbyists are bad. I completely agreed with that. Like, I was just like, what happened was I basically called people in different states that had fought these bills. So Oregon and Washington had won their bills and kept their religious exemptions. And so I called people there. I called Barbara Fisher at NBIC. I called people in Illinois. We're also going through this. And everybody said, you need a lobbyist. You need a lobbyist. And I was like, but they're like bottom barrel scum. Like we should be able to do this with thousands of people showing up. Why do we need to hire a lobbyist? And they all said, you don't understand how this works. You need a lobbyist. So we did find ultimately a lobbyist. She is amazing, but at the same time, all the rest, we went through a number of it who were working for pharma or wanted to work for pharma that didn't want to take us on because they couldn't get as much money from us as they could from pharma. But that year, the CMA, the California Medical Association, which is the lobbying side of the medical, doctors, they spent $8 million on lobbying that year and spend that about every year. So, I mean, we were hugely outspent. Same thing in 2019. So it is, we've worked out, I'm going to say, tricks of the trade that allow us to be successful where it is not, where we're doing grassroots and we are building relationships over years with legislators and building relationships. I think the more important thing is with other organizations, whether that is, school groups or associate, like during COVID, they were trying to get an employee mandate through on the COVID vaccine. And we alerted the Growers Association, all the unions. We alerted them and said, look, you've got to be against this. And they all came out against it. And so that bill didn't go anywhere. But it's those, it's having those relationships and the people the unions are huge in California. They have way
Huge.
more sway than we do. So if we can get the unions on our side, we'll go for that. If we can get the, Teachers Association or the colleges boards, on our side, we kind of use that as leverage for the work that we're doing. And that allows us to be more successful.
Well, and you have had success, but I always just get discouraged hearing numbers like $8 million, through the CMA for 1 year. It's like,
Yeah.
how do we even stand a chance to,
Yes.
we're just mamas and trying to do our best in a state that is hell-bent against us. So have
Yeah.
you felt that discouragement, or do you see going into this next legislative year that we actually could continue to hold the line and maybe even roll back some of these insane laws? And,
So I think it's one of two things. So I always look for the silver lining. I'm in this for the long term. I'm passionate about getting our rights back. I don't think it's going to happen in the legislature. I'll be completely honest. I think we get our rights back from a federal level and from the legal side of things. I think, we have a lawsuit that would instate the religious exemption in California, and I think it's at the right spot. It's in the appeals court right now. We've got legal precedents from last year with the Mahmoud case, which was a sexual education orientation in schools. Another case in New York that went to the Supreme Court got pushed back by the Supreme Court and told that Mahmoud needs to apply. So those things, if we're going to win the religious exemption case, it's going to be, I would say, towards the end of this year, next year. And if we cannot win it, then we're never going to get religious rights back in California. So it's, I am hopeful, but I don't think it happens through the legislature. There isn't a legislature that wants to take the vaccine issue on. It has to be a Democrat legislature because we have a supermajority of Democrats, so we can't get anything done with just Republicans. Unfortunately, and we have a Democrat governor that is going to be running for president. So I'm pretty sure he hasn't announced, but everything looks that way. And so he is also looking at it. There were bills that were not signed by him last year in the last session that were just ridiculous bills that he should have signed. They were great bills they should have signed, but we're pretty sure he didn't sign them because he's looking at the presidential view through the presidential lens of what's gonna it may be good for California, but it's not good for the Midwest states or some of those swing states, and so he held off signing them.
Okay, let's talk about those lawsuits that are challenging SB 277 and how, even in light of that, with the 2019 276 and 714 Senate bills that Governor Newsom signed, both of those tightened medical exemptions even further, with state reviews for doctors issuing multiple or schools with low coverage. And just your perspective on why in 2026 are we still seeing medical freedom in the Golden State under such insane dystopian assault? We are facing tremendous uphill battles with our medical freedom with our kids. And for the listeners who aren't aware, and I'd love for you to just chat on this, I think it's insane that if you have a child from daycare, preschool, kindergarten, all the way to college, if you are not subscribing your child to every single injection in California, your kid does not get to go to any of those in-person facilities. And people will say, well, you can find a doctor, right? I get so many DMs that are, do you have any recommendations for a pediatrician? No, I don't, because you can't get one. But why? What do you think is the reason why in the state of California 2026, it is still tightening against medical freedom?
My synopsis of that is there are still people driving around with masks on alone in the car in California.
True. And you see it up in San Francisco. I see it down in San Diego. I know.
So if you live in a state like that sort of sums up our state here. I think one clarification I do want to make is there is one exception. So if your child has an IEP, an individualized education program, if they have special needs, they can go to school fully without being vaccinated.
Yes.
So I just want to make that
Good
clear
point.
to viewers. But from the most of us that don't have special needs children, there are a lot of them out there. But if you don't have a special needs child, there is basically no way. The medical exemptions are impossible to get. You can no longer base it on any kind of genetics. You basically have to have close to died from one vaccine to get out of that vaccine.
Yes.
But you're still expected to get all the other vaccines. And so, I mean, it's insane. California, just the legislatures and especially the governor are very pro, and it's interesting because I say the governor, but I don't think his wife is, but are very pro-vaccine. I think his wife is more, I will give her some leeway, and I think she is more cautious and more concerned. But I think from the perspective of California, there is just a draw that everyone should get vaccinated. I mean, California still recommends the COVID vaccine for healthy children and healthy adults. And, the CDC changed that, and California still recommends it. And so it's just, we're living in a dystopian world. I agree with you. It's not based on science. It's not based on, logic. Another example is every other state, and this is one of our lawsuits. You asked about our lawsuits. One of our lawsuits has to do with titer testing. So for those of your viewers that don't know, if you get your blood drawn, you can test whether it has antibodies for different diseases. And for most people, if you've had the disease and or if you've had one vaccine of the disease, you're likely to have titers. Now, if you've gotten the vaccine, some of those wane, and so you may not show immunity, but there is a chance. So in most other states, all but California and Nevada, you can bring to school a titer test showing that you're immune as well as your vaccine. And that takes place of any vaccines that are missing that you have immunity for. We have a child in school in one of our lawsuits that had a severe reaction to one vaccine, is pretty much fully vaccinated, is missing 3 lost doses, and has titers for all of them. And the school, agreed that it was worth it, and it was a mainstream doctor, put in the medical exemption, and CDPH reviewed it and revoked it. They appealed it, put in all of the information, and CDPH still revoked it. And so that child is not supposed to be in school. His school is allowing him during the course of the lawsuit to be in school. But we are fighting for that. If you have titers, if you have immunity, you should be able to be in the classroom. But that's the craziness. California universities, CSUs, UCs allow titer testing. Most private colleges, healthcare settings allow titer testing, but California schools do not under the law. And so that's just an example of, where California statute is just so much more extreme than the real world experience of everyone.
Tell me about those two. So you have 2 lawsuits right now.
Yeah, we currently do, yeah.
And both are related to 277.
Yes.
Okay, one
yes,
is
and
on
so
the
one is for the titer testing, and
Mhm.
then one is on a religious exemption. So the titer testing I just talked about. The religious exemption, we have 3 families who are really good, solid plaintiffs. One is a family that the 2 parents are pastors, and they homeschool their children because their children can't go to school because of religious beliefs. One of them is a teacher that has also a youth pastor, but he is a teacher in the school where his child would go. During COVID, he had a religious exemption for employment because that's required by the Civil Rights Act. But his child, who has, it's his religious beliefs that govern the child's entry to school on a religious exemption. His child, he has the same religious beliefs, was not allowed into that school with those religious beliefs because she wasn't fully vaccinated. And then third plaintiff is similar along those lines. And so we feel we have a really strong case there. We've got great plaintiffs. The state tried to get it dismissed. We went to the appeals court, and the lower court judge agreed that it should be dismissed. Thankfully, we expected that because it was the lower courts in California. We're in the appeals process in the Ninth Circuit right now. And I think, when I look at the outcome of this, either they deny the appeal and it goes to SCOTUS, the Supreme Court, and it gets kicked back down with the same statement that the Second Circuit got, which is you need to apply Mahmoud. If you apply Mahmoud, which is this, parents have the right, and specifically homeschooling isn't equal to public school, which is our argument. And so that would happen. Or the Ninth Circuit says, nope, the case can't be dismissed, in which case it's thrown back to the lower court and we go through discovery and depositions and that kind of thing, and the case moves forward. So,
okay, tell me about for the listeners who are not familiar with Mahmoud. Can you explain what was that case and why did it get pushed back down again to be reviewed by the lower court?
Sorry, the Miller case got pushed back down. The Mahmoud case is final.
It went. Okay.
It was a Supreme Court case, and it basically, there were a number of different parents from different religions, and they were suing their school, because their school was not allowing them to opt out of gender and sexual orientation classes, or let the parents know and say, no, I don't want my child to be to be taught that. So
Mhm.
basically, they were teaching and talking about transgender pronouns, those types of things. And these parents from a lot of different religions came together and said, we don't want our children to be taught that. If you're going to teach that, we want to opt out. The school district said, you don't get that say. If you don't want to be in school, if you don't want them to learn these things, then homeschool.
Okay.
And the case was homeschooling is not the same. We should be allowed to have free and public education, and we should be allowed to opt out of these, opt out or know what our children are being taught. And it failed in the first two courts. And the Supreme Court said, yes, you have the right. You have the right to be in school. Homeschooling is not the same. You have the right to be in school, and your religious beliefs should be honored in school.
And when was
And
that
so
rule? When did that ruling come down? Do you remember?
last summer.
Okay,
Last
yeah,
summer,
I
I
thought
don't
it
know the
was pretty
exact date, but
recent.
last
Now,
summer. Yeah,
the Miller case, that one, is that connected to the Amish?
exactly.
Okay,
Yes.
so
So this is in
share what the
upstate New.
Miller case
Yeah,
is too, because that's different, but it
yeah.
all
It
connects.
ties in, yes. So the Miller case is in upstate New York, Amish school, Amish children on Amish land. Now, Amish land doesn't have, if Native American land has their own territorial rights, Amish land doesn't have their own
Mhm.
territorial rights, but that's what they were arguing was it was just for Amish children, just Amish, it was an Amish community. And they were allowing religious exemptions for their children to go to that school and not be vaccinated. So the Amish have very, very low vaccination rates.
Mhm.
And the state of New York came after them and fined the school for allowing religious exemptions. And so they have a lawsuit. Both the school and the parents have a lawsuit that basically said, we need religious rights and religious exemptions for our school. And that went through the lower court, the appeals process in the Second Circuit. It was dismissed. They lost in both of those, and they went to the Supreme Court. The Supreme Court didn't rule on it, but it did have a cert, which means it threw back. It basically gave an opinion, a paragraph opinion, and threw it back to the Second Circuit, and specifically said, you need to revisit this case in light of Mahmoud. So in light of these parents that homeschooling wasn't the option and you need to honor the religious beliefs in school, you need to take that case and look through that lens at this Amish school case. And that was a huge win because we have Mahmoud cited in our case and we make that argument, but we didn't know if the Supreme Court would and anywhere else would look at Mahmoud as a case that can be applied to vaccine mandates. And the Supreme Court basically said it can and it should be. And so that's a huge win, and why I'm hopeful, really makes me hopeful for our case.
Wow, that's huge. And then
Yeah.
the Miller case was really recent, right? That came
Yes.
just a couple, was that
Like
November?
it was just before Christmas, I'm
S-
going to say end of November, beginning of December.
So there's a lot of hope in that. And I remember I had a guest on, he was an attorney for, it's gonna fly away. I'll link the interview below because it was on national medical freedom, and this was prior to the Miller case ruling or being pushed back down. But he was saying that that could be a huge case to watch for families in California, because if that went the way that he hoped, which it did, he said this could set a major precedent for all of the dystopian laws we have out here, which is the common question I get anytime I do one of these interviews. It's like, are we ever going to get our religious freedom back? I'm like, I don't know. We're fighting.
We're trying. We're really, really trying hard.
But things look good. Things are looking
and I
good.
think the thing that you should also note is that we filed this case in 2023. It has taken 2 years, over 2 years for us to get to this spot. But at the time I was like, oh my God, this is taking so long. This is taking so long. I am a true believer in things happen for a reason. They happen at the time they're supposed to. And with that, we are in probably the perfect place right now with our lawsuit, having had these two rulings. If it had gone any faster, I don't think we would be in the right place. We would be in a more likely losing place because we don't have these two cases. So we're being in the appeals court with these two cases having happened. It's exciting. Yeah.
Hear that, California? We're on life support, but there's hope.
There's hope, yes.
When do you expect any movement with either of those your two cases?
Yeah, so we expect both of them are moving forward in the appeal. Well, the titer testing, actually, we won the dismissal, so it was not dismissed. So we are still in the lower courts for that. I believe we have a hearing in February or
Okay.
March on that, and then the appeals, we have a hearing on the religious exemption we have in April. So it's moving forward. We're going through sort of, there's a lot of steps, and legal work takes so long.
So long.
I have parents all the time that call me, "Can you get me a lawyer so that I can sue somebody on this front?" And I'm like, "Okay, you need hundreds of thousands of dollars
And 5
and you
years.
need like 5 years." Exactly. I'm like, we're getting COVID cases resolved like 2024 and 2025, or when COVID cases were resolved from 2020. So that's that's your time period. So
I know.
unfortunately, but we're
The
in a good
courts are
place
slow.
on
They're
this.
not.
I
They're
really
never
believe.
as fast as you want them to be.
Yeah.
Okay, if both of those cases were to go the best case scenario, the way you
Yep.
hope, it's a total win. Paint us the picture of what it would look like. Let's just call it December. Everything, cases closed, in your favor. What does 2027 January at this time look like in California?
California would have to put in place a religious exemption, so they would have to accept religious exemptions to school, and they would have to accept titer tests if we win that one as well.
It'd be
And
huge.
so it would be huge. Yeah, it would be really
It
huge.
almost makes me want to cry. It does. I like, oh no, I'm going to
Yeah.
cry because
Oh.
it's such a, I've been fighting for so long,
I know.
and for me, my story is
Yes.
very personal because, without giving too many specifics, I did not listen to my better intuition. And it was during, over a decade ago, this conversation wasn't as loud as it is now. And I remember asking all my mom groups, like, give me information on vaccines. I need information. I was pregnant.
Mhm.
I need information. And I remember like the closest I could get to thorough information was the Bob Sears book. And
Yep.
I highlighted that thing. My husband and I would go on date nights and just talk about it like we were in college. We'd go through everything. We'd run all the numbers. And we kept saying, like, I don't even understand why this vaccine is mandated, because when you actually run the numbers, it looks like there's more
Mhm.
significant risk in the vaccine. Long story short, we got in a really bad situation with a pediatrician at a wellness check. And it was like a hostage situation for my
Oh,
husband
geez.
and I. It was horrific. And I was not at the time as confident as I am now, because I've lived and seen and I'm smarter and all the wiser for
Mhm.
it. But it was hot pressure of, if you leave this office without giving the DTaP, your child could die. And,
Oh, I had those conversations with our pediatrician as well. I mean, she was willing to leave it at the parents, but the tetanus vaccine was the one that she really pushed. And she was just like, "I've seen tetanus. Your child could die from tetanus." And I was
yes,
just like, when you do the research on tetanus, it's just not. It's
it's
is there
not.
a chance? Yes, there's a chance, but the
There's
risk
a
of the
chance for everything, but that's the thing, is there's
exactly.
also a risk in the shots. And so
Hmm.
we did
Yeah,
go through with one of the shots, and immediately everything changed. Lights off, everything
I'm
changed. It was
sorry.
3
Oh
years of
gosh.
hell on earth. Uh, it was horrific.
Yeah,
Which is why I have so much skin in the game, because it woke
yep,
me up to the reality of the risk and
yep,
informed consent. And
yeah,
that's where all the, oh, here, just sign this and you have this exemption. Oh, that's taken away. Sign this and you have this exemption. I'm like, what is going on? I was never given the VAERS information, so we never filed a report.
yes,
We should have all of that. It just woke me up to everything, which is why now, seeing us finally come to a point where maybe we will come out of this on the other side. Oh, I just would be a
yeah.
little puddle of tears.
I know, I would be too. Like it's people have said, well, what, if there was anything, if I had to drop everything, I love what a Voice for Choice Advocacy does, right? We advocate for all the areas of MAHA, so food and EMF and all of those different things. But if I had to drop everything and only take one piece forward, it would be that religious exemption,
Mhm.
because that's what started this, and that is what is just if we can win that in California, it would make such a difference for so many parents. The other stuff, you can work out food, you work out cell towers, you can work out those things, but this is one place where we're truly stuck,
Mhm.
and
Mhm.
everyone in California is stuck with something that just is beyond absurd, in my
Yeah, and
opinion, that
beyond
you
what it
can't
should
have
be.
your
We've made it into January, which means all of those New Year's resolutions are about to hit. And one of the most common resolutions is to get healthier. So, what if I told you there's a really easy, practical way to make your home still just as beautiful, to smell just as good, but way less toxic. An easy transition is to pick up resistance candles. These have become my absolute favorite. They are not only absolutely beautiful, they are clean, made in the USA with coconut apricot wax. No soy, no toxins. You get a really clean burn. All of their candles are paraben-free, phthalate-free, which are two things that I always watch for when it comes to ingredients. And not only that, but they smell so good. I can't get enough of them. So if one of your New Year's resolutions is to be more health conscious this year, a really easy transition is to switch from whatever you're burning in your house to resistance candles. Head to resistancecandles.com and use code ROOTEDWINGS for an exclusive discount. Moving into what the landscape shifts have been with MAHA, because we keep bringing up MAHA. But one of the big changes was just this chiseling down of the recommended shots for kids through the federal level. Can you tell us how this affects us in California? Is California agreeing with this, Christina, or are they putting up a fight?
Yeah, unfortunately not. Unfortunately not. So California, it's interesting because prior to 2025, we would go into legislative offices and they would say to us, we're not going to change anything on the vaccines. If the CDC changes that on the vaccines, then we will make changes. So, the CDC is God and the Bible of vaccines. And so 2025 comes along and I'm like, okay, we're making changes at the CDC. And California Governor Newsom says, nope, we are changing. And this was a bill, AB 144, that came out right at the end of session, was pushed through with no time at all. But it basically removed every reference to CDC. They went and did a find replace in our whole statute in California, removed CDC and ACIT and replaced it with CDPH, the California Department of Public Health. So when it comes to vaccine policy. So the California Department of Public Health in California is the vaccine policy guru and the one that is really doing the changes and making the changes in our vaccine policy. That passed in September. The CDC came out with their revised COVID, flu, and RSV guidelines at that time. And California said, yep, we're going to go with different guidelines that were formulated by the AAP, by the American Academy of Pediatrics, and the AMA, the American Medical Association. And we are creating this West Coast Health Alliance. So California, Washington, Oregon, Hawaii, I don't think Nevada, but maybe Nevada, came together.
Yeah, I feel like there were 5, right?
Yeah, I feel like it's Nevada. Came together and said, we're doing vaccine policy. We're going to work on it together. The East Coast, New York, Connecticut, Massachusetts, and a few more states, New Jersey, all came together and did the same thing over there. And are basically have said, we're going our own way. California put in place that everything stays as of January 1st, 2025. So prior to that is the vaccine schedule, unless we make changes to it. And so the CDC last week came out with a new schedule that keeps 11 recommended, and they're only recommended. They're not mandated. Nothing is mandated. They're recommended 11 diseases, which are your common diseases: measles, mumps, rubella, varicella, which is chickenpox, whooping cough, those types of things. And then they made the rest of them, they either removed them or they made them shared decision making. So shared decision making means that you go into your doctor's office and you have a conversation about the risks, the benefits, whether this is appropriate for your child, whether, it's really a conversation. And that's, at A Voice for Choice Advocacy, that's the biggest thing we want people to have is conversations about this. If you end up deciding that you want to get your child vaccinated to whatever extent you want them vaccinated, if there's one disease that you're really scared about and that's the one you want to get them vaccinated, we're not going to say don't do it, but we want you to have the conversation and the knowledge to make that informed decision. And so that's really what the revised CDC schedule does. It keeps in place the diseases that are mostly contagious diseases. They're the common diseases. They're what every other European Western country vaccinates for. But then there are these other ones that are sexually transmitted or not a huge risk, or like COVID or the flu, where the vaccines don't really work that well, that are this shared decision making. And California basically has said no to that. They are sticking with the full schedule as it was of before January 1st, 2025, which is the full schedule.
Is that legal? I mean, it went through the legislature. It was rammed through midnight politics.
Yep.
But is that legal, or do you expect a federal challenge to that?
Unfortunately, I think it is legal. And on the
Mm,
flip side of it, it allows Florida to do what Florida's doing, right? And
okay.
removing all requirements. So, you kind of have to play that game of, if you don't want it to be legal in California, then somewhere like Florida is also not legal, making their state
Right.
policy. But I do believe it is, when you look at all of the regulations on the federal level and the state level, and the Constitution, and the laws, the statutes, the states are allowed to have their own vaccine policy and guide their own vaccine policy, because healthcare falls under a state guidelines rather than federal guidelines. So it's the reason why every state has their own medical board and oversees their physicians, those types of
Hmm.
things.
Which, I mean, it's hard when you're in the losing state, but when you do look at it, it also offers freedom. And it is the way that it's supposed to work. It's just frustrating when it
Yeah.
works against us.
Yes.
Um, are you happy with what you saw come out of the MAHA aligned, Denmark aligned new CDC recommendations, or do you think that there's more work to do?
I think it's a good it's a solid first step. I mean, I think it definitely brings us to a place where this vaccine schedule is no longer exploding. I mean, since 1986 and the Childhood Vaccine Act, it has, our schedule has just exploded from, it was, I think, 18 different diseases that we were now vaccinating for. Um, it, that's been reduced to 11 that are recommended. And I think it just brings it back into perspective. I think the other thing that is good is that the FDA is being much more conscientious about approving vaccines, and ACIP is being much more conscientious about approving that vaccines to be put on the schedule, or what should be on that schedule. I think there's more thought to it. Prior to this administration, I went to ACIP meetings, and they would do studies on 220 people, 200 people, which is nothing. We have a population of 300 million.
Yeah.
And they would do these studies, and it was just everybody, even if there were concerns, everybody voted these vaccines onto the schedule because it's a moneymaker, and it's,
Mhm.
it's the way it is. So I think it's a good first start. I think we will see more. I think, this is the first year of the administration. We've got 3 more to go. And I think we will see more based on science. So I think there is science being done currently that will come out with other recommendations. I thought one of the interesting things with this new CDC schedule is it lowered the HPV vaccine dose from 2 doses to 1 dose. And there is science that shows that 1 dose of the HPV vaccine is as effective as 2. I won't say it's effective, but it's as effective as 2. And so bringing that down, I can see a few more of those happening. I can also see something like titer testing being brought up
Mm.
and saying, after you get the first MMR vaccine, go get titer tested and see if you have the immunity, the antibodies, and, get that testing done every, I don't know, 2, 4, whatever it is, years, and see whether you continue to have immunity, because at that point you don't need to get the second vaccine if you
Mhm.
have the titers. So I can see things like that happening. I don't think it's the end of it. I don't think this is it, a slam dunk, and we're done.
So for a family out here in San Diego, they have maybe kids going into kindergarten, so they're at one of those checkup appointments, or they've got a brand new baby, they're going in. They've heard about all of these MAHA wins. Yay, the vaccine schedule shrank, and they're so excited, so they go into that appointment. So this is a KPBS article that I'm just going to briefly read. It says San Diego, that's where I am, county
Mhm.
health officials said on Thursday that they will continue to follow the childhood vaccine schedule recommended by the American Academy of Pediatrics, the California Department of Public Health, and the West Coast Health Alliance, despite new guidance from the Centers for Disease Control and Prevention, the CDC. On Monday, the CDC updated its childhood and adolescent vaccine schedule, reducing the number of vaccines routinely recommended and reorganizing them into routine, risk-based, or shared decision-making categories. The changes were made without the usual input from pediatric and vaccine advisory groups. This is a quote. The American Academy of Pediatrics does not recommend any changes in the vaccine schedule, said Dr. John Bradley, a pediatric infectious disease specialist at Rady's Children's Hospital. And Rady's Children's has so many issues. Don't even get me started on the investigative work
Yes.
we've done into that hospital. We wish the CDC had presented their recommendations in one of our regular meetings, and we would have had a chance to discuss it. Despite the federal changes, Bradley said the science behind childhood vaccines hasn't changed. That includes 6 vaccines the CDC is no longer recommending. We believe the vaccines for RSV, hepatitis A and B, rotavirus, flu, meningococcus, how do you pronounce that? Meningococcus?
Meningococcal, yeah.
Okay. Should continue to be given, he said. The CDC changes put additional pressure on parents, Bradley said. Parents don't know all the questions to ask. They're parents. That's their job. They're not medical professionals who spent their life reviewing vaccine data and coming up with recommendations, he said. All of that.
Oh, boy.
Walk me
Yes.
through this, Christina. Walk me through all of
Okay.
this.
So maybe I'll go backwards. Parents aren't, but the fact that he says that pediatricians have all this knowledge, if you ask a pediatrician how many hours of vaccine education they got, it's like 3 hours. Don't quote me on this, but it's a very limited amount. And what they basically have been told is how to inject, what the vaccines are, what the vials are. It's not about risks. It's not about benefits. It's not about research. It's not about any of that. So that statement is, flies in the face. I think most parents are more educated. The ones that do any research on vaccines are way more educated than any pediatrician that hasn't done that, that has just gone through standard medical school. I think it is a place where I think the biggest issue, honestly, is going to be parents are going to go into these doctors' offices confused as to what, you've got federal guidelines and you've got state guidelines, and they're not the same. And so you've got pediatricians. I mean, what is the pediatrician supposed to go by? Can they choose which one they go by? If they're under the California Medical Board, do they have to go by what the California Medical Board says? What happens if they follow federal guidelines and don't recommend the COVID vaccine? Before this, they got reprimanded or they got, prosecuted because they weren't following the CDC guidelines. And so if you strayed away from exactly what was recommended, you were likely to be in front of the California Medical Board. So what are they supposed to do? So on a pediatrician level, there's confusion. On a parent level, well, I don't think my kid needs the hepatitis B vaccine at 1 day old, so I'm going to refuse that. Am I now, I'm going with what the federal guidelines said because I agree with that research or I've done my reading. But if I'm in California in a hospital, are they still going to be pressuring me to get this vaccine and, really bully me in the hospital on day 1? Who knows? And, the biggest piece of this is there is such a lack of trust since COVID in the medical institutions, in doctors, that, I don't mind that because it's making people wake up and question what's going on. So, but if you look at it just from sort of a mainstream, you want to be able to trust your doctor. When you're sick, you want to be able to trust your doctor. When you've got a healthy child, you want to be able to trust your doctor to give you that healthy advice. And it's not happening in California or any of these states because there is this dichotomy of what should they go by. So I think the trust will be even more eroded in California when it comes to pediatrician visits from parents, because I think there's just going to be confusion.
Especially because of what you just mentioned, that it always comes back to follow the money. So I know we have just a little bit of time left with you, and I want to get to all the questions that my audience sent in for you. We're going to do a rapid fire with you at the end. But I just want to touch on that again. I know we kind of started in the beginning, but can you go a little deeper into the corruption, since that's a big word we're seeing right now for California, but the corruption as it plays out in the politicized medical world of California and what you have seen?
Yeah, I mean, there's just money everywhere. That's, the pharmaceutical industry puts money into lobbying, into hospitals, into education facilities. Like that's what's running our current, I'm going to say sick care system is the pharmaceutical industry and getting you on as many drugs as possible. It's not on getting healthy. It's not on getting, it's turning slightly, but it is mostly on, here's another drug to fix that.
It's keeping people sick so that they can keep profiting.
Yep.
And if you get the kids early and young, then you have a sick customer for
life customer.
life. Yes.
Yep.
Let's go into some of these rapid fire questions
Hmm.
that came in because I got a lot and I highlighted some that were the repeat questions just to throw at you.
Hmm.
So, are you ready?
Yep.
This is the hot
I'm
seat.
ready.
Okay.
Yes.
Uh, are there any loopholes for families stationed in California only on military orders?
No, unless you have an IEP, but no, there's no exclusion. I think you can get into school without vaccines for maybe 3 months. So but they're waiting for your vaccine, you know, documentation to come. So that's true for foster kids, military kids, and a few others fall in there, but there really aren't any long term ability to do that.
How much have the ingredients in vaccines changed over time?
Not at all.
Mm. Do you know why it is that you can't separate vaccines? Why are they all you have like 3 different live viruses or
Yeah.
whatever viruses are covered in one shot?
Yes. So it used to be you could get the measles, mumps, and rubella vaccine separate, and then they combined it into the MMR. Some countries still have, like Japan has a combination of 2 and 1. I believe they have measles separate and then mumps and rubella together. And there are some countries that still have the MMR separate. Not many anymore. But it's a marketing. I mean, it's the pharmaceutical industry. It's the greatest example of that is the one that has diphtheria, tetanus, and pertussis
Mhm.
in it. Pertussis is whooping cough. So whooping cough is the only contagious disease out of those 3. But in order to get the pertussis vaccine, you have to have diphtheria
Diphtheria
and
and
tetanus.
mhm.
And so that one to me is the most ridiculous. Give us just a plain pertussis vaccine
I
because
agree.
you wouldn't need the other 2.
Yep, I agree, and there is so much on DTaP. Everyone wants to talk about MMR. People need to start really researching
Yeah.
DTaP. There's a lot there.
Yeah.
How can state law violate constitutional rights?
I can't. That's why we have our lawsuit.
This is true. Good answer. Follow the lawsuits. And for
Yes.
those who are still with us, look in the show notes section because I'm going to have so many of the resources that we have talked about, the lawsuit information, how to follow Christina will all be at the bottom. So don't leave yet, but that's all that information will be fully loaded below. Mandatory Tdap for junior high and mandatory meningitis for college. Why? This is so dumb.
Yeah. Well, the Tdap is because every 10 years you're supposed to get a booster. That's throughout your life, you're supposed to get a booster. Not many people do, but you're supposed to get one. So that's the 7th grade one. The meningococcal is because you're living in dorms. And so they feel that it may spread quicker in dorms. So that's the reason for it. Do I think it's correct? No. I mean, it's been the meningococcal has been removed from the recommended list. So.
Are
Yeah.
homeschoolers at risk of being required to vaccinate in California?
I don't think so. I don't think it'll go down that path. I think there's too much. uh, They have to be able to say we have an out, like go homeschool. If you don't do that, then you're really eliminating rights, and you've already eliminated rights. Don't get me wrong, but
I don't know.
but
If we get
I don't
Katie
think it will.
Porter and Christina Hildebrand, if Katie
Yes.
Porter,
Well.
it can only go downhill from there,
Yes.
okay?
Yes. But it has to
Oh,
pass. I mean, that piece of it has to pass the legislature, right? And
yes.
I think we now are, I'm going to be really honest. I think we are now savvy enough. If I knew what I know today, SB 277 wouldn't have passed in the way it would have
Mm.
passed. We would have had a religious exemption, or it would have just been for the MMR, or it would have just, it would have been different. We would have amended that language. We would have gotten it to a place where it would be bad, but it wouldn't be as bad as it is today.
There'd still be
So,
protections.
yeah.
Okay, with the 2026 legislative season session starting, can you walk us through quickly how this all works?
Yeah. So California, this isn't a short answer, so I'll be as quick as possible. I will say on our website, we have a full education. It's under legislation, and it's all about the legislative process in California. So if you're really interested in it, it's so well done. Somebody on our
It
team
is.
did it.
It's
So well
phenomenal.
done.
It's very
Um,
I refer to that a lot when I'm trying to
I
explain
would
it.
go
Very
there.
helpful.
Just quickly, California has one of the longest sessions and most frequent sessions. So we have a full 9 months of legislative session every single year. Other states do every other year. Other states do 6 weeks. I mean, it's amazing being in other states, but here we have 9 months. It's a full-time job. And it starts off, bills are introduced. They go through committees on one side of the house, go through committees on the other side of the house. If they make it all the way through that, each house has a floor hearing at the end. It makes it through that, goes to the governor in September. There are over 3,000 bills. That's 3,000 changes in legislation every single year that are introduced. And
So
about
wild.
900 of them make it to be signed about 1,000 make it to be signed, get to his desk, and about somewhere between 700 and 800 get signed. So there are 700 changes in law every year in California.
My gosh.
That you can come up with that is amazing.
And
right?
you, with a voice for choice, this is why I
Yes.
wanted to have you on. Not only do I love you just as a person, but
Thank you.
you are a fellow warrior in this fight and one of the best of the best. But you
Thank you.
monitor every single one of those when it comes
We do.
to, and
Yep.
you, like you said, you are OG MAHA before MAHA was a thing. So tell
Yes.
us, what are you watching going into this next session? What should we be watching? And then we'll wrap it up with how people can follow you, support you, get informed, all of that good stuff.
Yeah. So I would say one of the big things that differentiates us from other medical freedom groups in California is that we support bills as well. This year we had 30 bills that we supported that were all MAHA oriented, that, removed ultra processed foods from school lunches, that removed toxics. We also have bills that we have personally sponsored. So we have gotten legislators, and we've got 15 bills on the table that we're trying to get authored. We at most will get one of those authored. Like it's a it's a crapshoot on how they have their passion projects. But if we can get one authored, we've got a good track record. In the past 5 years, we've gotten 3 authored. So we have a really good track record on that. But we watch all the bills, the good, the bad, and the ugly, and we really focus on all of them. So we go in and we support bills, and that's how we build the relationships. That's how we can. That's how the HPV vaccine got to be only a advisory versus a requirement for K through 12 schools, was because we had those relationships with the legislature, and we went in there and we talked with her, we talked with our staff, we talked with all the other legislators and brought rational points up. But because we're in there every single week, they know us. They know who a Voice for Choice Advocacy is, and they know that when we bring an amendment, we're not bringing something that is crazy. We're bringing something that is really solid and that needs to be considered. And most of the time it does get considered. We've had a lot of amendments to bills that have really changed the bill to make it something neutral.
What are
Or gotten rid of the bill.
what do you think, because you're already seeing what's coming down for this year, what do you think are the ones that we should be paying attention to? If you had to say,
we're
like,
not
within
quite,
top 5, or are
yeah,
you
we're
not
not
there
quite
yet?
there yet. The bills have to be introduced by mid-February, and so it'll be mid-February when we have that, when we're starting to go through that list of 3,000. So by mid to end of February, we'll have our list of what we're looking at. I think just having talked to lots of staffers in the last 2 weeks, I think there will be quite a few bills that MAHA can support, MAHA followers can support, that get toxics out of different products. I think that's the interesting thing in California. There's this dichotomy that the Democrats are very, very MAHA on the environmental issues and on the toxicity issues, right, and food issues. So those we can get through the legislature. I'm not going to say easily, but we can get them through the legislature much easier. We can get them through. When it comes to vaccines, when it comes to fluoride, those are the two that are, your conspiracy theory and crazy if you come in and talk about those. But even those, since COVID, I will say, since COVID, the vaccine issue is a much more, I'm going to say, talkable topic, because all of those legislators, the majority of them, got vaccinated more than once, and all got COVID. And we had come in before that saying it doesn't stop transmission, and they recognized that after they got COVID for having been vaccinated. So it is a slightly different discussion, and they know people who were vaccine injured or had a reaction, even if it was just the weekend after that they were laid out for it. But so it is a different discussion now, having gone through COVID. As I said at the beginning, I always look for the silver linings. I look for where we can go for the positive, because otherwise I wouldn't be doing this.
Yeah, but it seems like 2026 could be a really big year for us in California, especially with your 2 cases moving through, hopefully, to win us back our religious freedom, going into next year. The legislative season will close in November. Is that right? When all
September.
September
So
is when
September, like the beginning of September, the bills have to be on the governor's desk. The governor has a month to sign those bills.
Okay.
So the full legislative session is done in October, but the legislature is out of session at the beginning of September.
And you're going to be monitoring everything. You're going to be sharing the how-tos, all the information that
Yes.
moms like me, especially
Yeah.
moms who are busy and feel like they can't keep up, you do all that. You keep up, and then you just put it out in little bite-sized pieces for us to consume and to push back on, and I think that's empowering because for the
Yes.
average mama who is holding a baby on one hip and homeschooling all the rest of the kids, you can still be involved. That's how I
Yes.
started, was just
Yeah.
it doesn't take a whole lot if you link arms with people like Christina. So, Christina,
Yes.
I want to just honor you and tell you how
Thank you.
thankful I am. I wouldn't have been able to stay in the fight as long as I have if it wasn't for you. So,
Thank
I
you. I
um,
appreciate
I
that. And
really
I
do thank
appreciate
you.
you because you definitely have given it a voice, and I really appreciate
And I
that.
will
So thank
continue.
you.
I'm like you. I'm in it for the long haul. So, how can people follow you, get involved with everything you're doing, and check out all of the work that you've done thus far?
Yep. So the big thing I would say is join our newsletter. So if you go to our website, which is a voice for choice advocacy.org. If you just look up a voice for choice advocacy, it'll show up. If you go there and just sign up for our newsletter, to your point, we only put out stuff that I'm going to say is worth reading. So
Yes, I
we
agree.
don't put fluff out there. We don't have any advertisements. We don't have anything like that. All we put out is stuff that we think is really important for people to know. And the other piece that I will say is we are very everything I do is solutions based, and everything our organizations does is solutions based. So you will never be left with well, how do I make a change, or what's the answer to this? If we don't have the answer, we're not going to put the statement out until we have the answer. So our newsletter is the big one. On social media, we're on Instagram, Facebook, X, Telegram. It's all at A Voice for Choice. For is FOR. But those are our social media platforms. If you go to our website, they're on the top. You can just click on them from there.
I would heartily encourage everyone listening to go follow Christina and the incredible work that she has been doing, just as one of the only ones truly doing the deep dive into California's fight, the lobby realities out here in California, and then all of the MAHA ripple effects that we are seeing now, but Christina was ahead of. So go follow her and all of her good work. Christina, thank you so much for your time and all of your work. And here's to a very good, hopefully good
Yes.
legislative season out here in California. We get to kick it
Yep.
off. So
Yes.
thank you again so
Thank
much.
you.